Yes, hello, and thank you so much for joining us. We're at the addendum for the webinar with Dr. Chi, and we're speaking a little bit about some of the questions we received earlier. And just to let you know, we do offer at Five Branches University some trial courses that you can find by going to fivebranches.edu. That's fivebranches.edu, where you can check out more about Chinese medicine and whether you might be even interested in joining us for a world-class education. And Dr. Chi, thank you so much for joining us again. And we're talking about some of the questions that came up in the prior webinar about stimulating innate healing. The question we have is, do you use Yu Ping Feng San for individuals that have high blood pressure?
Sure. Yeah, let me explain about what Yu Ping Feng San do to our body. Of course, we talked about the astragalus last time. That is actually in the research. We also found out that Huang Qi, which is astragalus, actually helps to boost up our immunity, or we can say balance immunity. Yeah, and there's a lot of the autoimmune diseases. Actually, we also use Huang Qi to boost up the qi, or means energy. We don't use herbs in the way of like traditional Western point of view, but we use the herbs in the traditional Chinese medicine point of view. So Huang Qi, this herbs that is why it's the major king herbs in the Yu Ping Feng San. It helps to boost up the immunity. Huang Qi actually can promote urination, okay, and reduce edema. So we use Huang Qi in this aspect a lot. In this point of view, Huang Qi actually can help, balance the blood pressure. If the blood pressure is, and patients have some blood pressure issues. So using Yu Ping Feng San together with high blood pressure medication, it's not going to affect the medication, or there's no contradiction of each other.
Very good. And we'll take the next slide, please. And then we wanted to talk a little bit about the common name of astragalus.
Yeah, this Huang Qi, that's how the Chinese herbs, Chinese medicine called Huang Qi. So if you want to buy this in the Chinese supermarket, which is usually available in the market, yeah, probably you have to say Huang Qi instead of astragalus in order to get the herbs.
Very good. And then we did have a question about a patient whose spleen was removed. And that happened when the patient was 10. Now the patient is 61. They have difficulty urinating, edema, especially around the waist, pain, a red tongue without coating, and a kind of a puffy tongue. And so the question had to do with, if I recall, whether you would use, is it Wu Ling San? If you can go to the next slide, I believe that there's a question regarding which herbs, Wu Ling San, if they also have COVID-19 symptoms.
Great. Of course. Let's talk about this particular case. I think probably the person who raised this question is a TCM practitioner. Difficult in urination edema, especially below the waist. This is basically in traditional Chinese medicine, we diagnose as a spleen and kidney yang deficiency, especially the tongue was presenting with puffiness. The red tongue, I'm not sure, maybe it's a slightly pale, but I have to exactly looking at the tongue and have a better judgment. But I will say Wu Ling San is actually a very good choice for this particular patient, unless the kidney energy was very low. Okay, then we have to add some kidney-fied yang tonifying herbs to balance out the draining power of this Wu Ling San. Of course, we also need to add a couple more herbs. Looking at the patient's more symptoms, it's a quite complicated case. I will highly recommend the patient to really be seeing experienced TCM practitioner and to really get the best treatments, and may not be able to take Wu Ling San for too long. Okay, yeah, let's go to the slice, Wu Ling San slice. Next one.
Very good.
So Wu Ling San in the Western uses, when a lot of doctors in TCM doctors will also use Wu Ling San for chronic nephrotic edema. We can use for cardiac edema. ascites due to the liver sclerosis and urine retention, Meniere's disease. So these herbs particularly go to the urinary bladder channel. And we know the urinary bladder channel starts from the head all the way to the toe. Okay, so the whole body's back is covered by urinary bladder channels. And you know the urinary bladder channel, one of the biggest function is for water, is to help the body to eliminate the excess water. So for the qi that flowing in the urinary bladder channel are get deficient, that will cause water retention. If the problems falls into this category, Wu Ling San is always a good choice to use. So only if the formula is a little bit warming, if this patient have a very indeficient or very and it's very dry already, or there is some conditions that the complication of like blood stasis, etc., then we have to also add a couple more herbs to balance out. But long-term using these herbs is not recommended. So of course, we say COVID patients usually we have to help the patient to alleviate their symptoms usually within a week or two. So using 2 weeks of a Wu Ling San is not a big deal. But for this particular patient, we'll still be very careful because they don't have the spleen.
Very good. Yes, that makes a lot of sense. We wanted to answer this question. Person wants to know if a treatment is altered in any way after a patient gets the vaccine. Would it interfere in any way? Actually, sometimes they can be copacetic together even better than one at a time, but I want to hear, yes, how you would respond.
I'm not quite sure the question is for a patient who already have a vaccine and then it got COVID, or is a patient have COVID already and then get a vaccine after recovered. So anyway, if the patients already started with any symptoms like COVID-like symptoms, we're still trying to balance the body. And remember, we're not treating the bacteria or virus. We're treating the body, okay? Means to balance the body, the environment, so the body have the best environment for the immunity to overcome the bacteria and virus. Or we provide an environment that actually not friendly for the bacteria virus to survive in the body. So doesn't matter if the patient still have the virus or not, or if the patients is still having test positive, we provide the best nutrients and then provide the body to return back to the best ultimate balanced conditions to fight the bacteria and virus. That's basically what the traditional Chinese medicine do to the body.
Very good. And then we have a question. Dr. Chi, do you use all of the formulas together? It is a lot of herbs, and we had listed quite a number of them, but we wanted to kind of get your take on that.
Sure. I think in the webinar, I mentioned that I use powder, okay? And the formula that I listed on the slides are actually formulas plus formula. Means that I treat a formula as a complete functional group. So, and then I mix match them. So for example, if I use 小柴胡汤, I'm trying to eliminate the dysfunction of the body or imbalanced conditions in the Shaoyang channel. Okay, and then on top of that, I want to make sure the urinary bladder channel can remove enough the fluid that's being built up in the lung or the upper back. So I use Wu Ling San. And the patient usually are actually lost their taste and have no appetite, fatigue. So I use Ping Wei San. So this is actually already a complete functional group. Even though if you look at the formula, there's a lot of herbs inside, but it's already cooked into a complete unit. And I just use the function. So you can use the function to plus the function. And then, so even though it looks like it's a lot of herbs because you have a mind of loose herbs, no, it's not. We're using the formula plus formula method. So it's okay to mix up the 5 formulas together and with proportion. and then depends on what function I want them as a king function. And then I will put that particular formula for more brands and compared to the other ones.
Very cool. I like that idea. It's really kind of, you get to see the complete aspect of the formulas and then add them together. I like that. During COVID treatment, do you recommend patients stop taking regular medications such as for hypertension?
Yeah, no. They can still take their hypertension medication, no problem. And all the patients who have chronic illness, and if they're still having any, there's no need for them to stop their medication.
Very good. And we got the question that many friends with COVID over 3 months still had not gotten their taste back. They have gas and so on. What could they do to treat this?
Okay. The formula that mentions the 玉屏风散, 玉屏风散 inside already have herbs to strengthen the digestion systems, which is already a very good formula for the post-COVID recovery. Today, I also will give a tips for whoever are practicing traditional Chinese medicine and the licensed acupuncturist. There's one point I use in my clinic that is very good for helping patients to recover from loss of taste and smell. But first of all, we have to remember loss of taste is actually related to digestion system, because we know if, according to traditional Chinese medicine theory, a good digestion system, okay, the glory or the expression of having a good digestion system is you will have your taste. Same thing, if you have the expression of a good liver function, is you will have a bright eye. Same thing for kidney. I think most of you already know. If you have a very good kidney function, you will have a beautiful hair. Okay, so if we see your hair is dry and it's turning white very early, and we know that your kidney energy is not very good, or you can say that if your eyes are blurry, and then when you're looking at the screen for just 10-15 minutes, and then you already cannot see much, and then this is an indication that your liver function is malfunction. So taste is actually an indication of your digestion system is not fully recovered. And we mentioned that in the patient's coding, right? And when a healthy patient, a healthy person, the coding is thin white coding. But if a patient who have a thick white coding, for example, just like the patient that with COVID, we already showed the picture to all of you, and then that's an indication that digestion systems is really get damaged because of the virus. So 玉屏风散, right? We have the formulas that can help the patient to strengthen their digestion system. If you have COVID, okay, you can also use 平胃散, right? 平胃散 inside also have the herbs that helps the body to return their function in the digestion system. Once your digestion system become fully functioned, then your taste will come back. Okay, of course, the gassy, passing gas a lot, that's also indication that your digestion system is working so hard to balance your condition, but not doing quite well. So we have to strengthen a little bit. So taking some herbs that strengthen the digestion system will be a good recommendation for you all. And then next slide, I'll show you a magic point that you can try. So this is called smell and taste acupuncture point from Feng Scalp Acupuncture. And many of you might maybe know that I'm specialized in scalp acupuncture, and this point is not in the textbook or traditional point. So this taste point is actually 3 chun anterior to the ear apex. Okay, well, we use this point to restore people's smell, taste, lost sense of smell or taste. Okay, this is very good. And also we can help like chronic sinus, memory, because some people who have sinus for too long, they actually also have a poor memory. Dizziness, Meniere's disease is a common cold, or you can actually use this particular point to treat eczema or psoriasis. Why eczema, psoriasis is related to smell and taste? Because smell is digestion system. Smell is the lung. I'm sorry. Smell is for the lung. Okay. If people lost their smell, usually the lung function or lung energy is low. People, if someone who lost their taste, is because their digestion system is not strong. So most of the skin issues are related to both the lung and the digestion system. So using this point not only can treat the digestion and not only can treat the smell and taste, at the same time, it also can help skin problems, which is related to food allergy, and also we can also help the even psoriasis. So it's quite amazing. And then I'll just recommend all the TCM practitioner can try in your clinic and see if that will help patients to regain their smell and taste. But of course, you still need to strengthen the digestion system and strengthen the lung. You can use the points in the lung channels and stomach channels, and together with this magic point, and see that can help the patient.
That is excellent. And we did get a question about a person whose relative did die in December 2019 after being intubated with a mystery respiratory illness. Because he had blood clots, they wondered if it was an early case of COVID. Afterwards, she was very sick with respiratory symptoms and no energy starting in December and January of 2020. Since then, she or he had problems with heart palpitations, nosebleeds, and congestion. Could it be COVID? Could it maybe be stress? And either way, what natural methods would help reduce those symptoms?
Okay. So for this patient, I would recommend her to do an antibody test, which is actually only costs about $10. Okay, if you go to the lab court, and then you can submit. I think is available to everyone, and see if you already build up the antibody. Okay, and if you already have the antibody, maybe, okay, probably that's an indication that you already got COVID during that period of time. And but as far as now, if you don't have shortness of breath, your current symptoms is just palpitation, nose bleeding. I'll say sounds like it's more stress related, because it's a mystery to you. You have this picture of your mind that someone that died, okay, and then right after that you have similar symptoms like COVID, and you probably enter this. You are kind of suspicious that you might have COVID, and then that's why there's a possibility that it's stress related. So I will give you a very simple practice to do every night before you go to sleep. Soak your feet in the hot water. Okay, and once you are enjoying the warmth in your feet, okay, and then we would like you to kind of deep breathe into it. Why I'm saying this is because nose bleeding is an indication you have too much heat on the top of your body. And it's quite common for people working in Silicon Valley. Oh, I'm not sure this question is from Silicon Valley, but anyway, nowadays a lot of people spend a lot of times on the 3C, like computers and your cell phone, and we use our eyes a lot, right? Of course, we're anxious about many things, and we see the news, we get nervous, and then it's quite common, of course, a lot of people don't sleep, sleep too late. So we have too much blood that's stuck in the upper parts of our body and not being able to, flow, smoothly. So those people usually too hot in the face and too cold in the feet. So the best ways actually is to soak your feet in the hot water, and then the blood flows to the feet. And that will also help you to have a good night's sleep. Once we drain the heat from top of the body to the lower, then the palpitation will disappear, the nose bleeding will get improved, and of course you will have a good sleep. And then with that, you will enter into a positive cycle. I believe after a while, you probably will feel much better. Let's try this tip first, and then this is also a good recommendation for all of you who have stress and have a good, soak your feet in the hot water every night, and then you will experience a very good sleep, and then you will wake up refreshed in the second day.
Excellent. And thank you so much, Dr. Chi. Of course, you can follow us at Five Branches on our community newsletter, on YouTube, Facebook, on our school website, fivebranches.edu. And again, thank you, Dr. Chi, so much. Is there anything that you'd like to end on with this?
I will just help, okay. I would just love to see more of you, having a peace of mind. And I do believe that we're very good and the vaccination, a lot of people already get vaccinated. And then we already have so many good tips in this video, and go there and review them. If you have stress, if you have any post-COVID syndrome, find a good practitioner and try acupuncture, you will definitely feel much better. And hopefully we will have a brand new start soon. And if you have more questions about TCM and how we practice, and feel free to send us an email, and we'll love to have some follow-up with different webinar.
Absolutely. You can email us at webinar@fivebranches.edu. That's webinar@fivebranches.edu. Thank you so much.